Dr. Lim, thanks very much again for joining us. So you were talking about starting the company in the mid-90s. And what was the original name of the company?
Actually, the research was personal. It started in the mid-90s.
Yeah.
We had another company that was formed before Vielight, and we decided, okay, we go with Vielight, and Vielight was formed and started operation in 2011.
2011. Okay.
So we're in business officially for 12 years now.
Great.
But the technology has been a while. We've been playing around with it. So I was the first one to actually introduce intranasal photobiomodulation to the world. I own the patents for that. But there's good reasons for understanding that it works. Yeah.
Very exciting. We've got a lot of people joining us here. So as people come on, let me just welcome everybody. Fantastic to have you here. I'm here with Dr. Lew Lim, who is just explaining to me that he had the first patents on photobiomodulation. Is that fair to say, Dr. Lim?
I wouldn't say the first patent of photobiomodulation in general, but intranasal.
Intranasal,
I've
okay.
got like, I don't know, I lost count, like 30 over patents in different places around the world. The way we try to reach the brain through the nose, the way we pulse, the way we get feedback from the nose to the brain, and various patents.
Fantastic. So there's a tremendous interest, as you know, in photobiomodulation. We've actually talked about this in the past as well. This has been helpful for people, and we're going to hear more wonderful data today from Dr. Lim. This has been helpful for people with concussive injuries, for traumatic injuries, helpful for people with cognitive decline associated with Alzheimer's disease, vascular related, and so forth and so on. And as Dr. Lim is going to show us today, even the different subtypes that we've described for Alzheimer's disease, where we see some people where inflammation is a big issue, other people where it's much more about glycotoxicity and insulin resistance, and others where it's much more about vascular damage or trauma. All of these are relevant for this exciting technology that Dr. Lim and his colleagues have developed. A lot of people have been very interested in Vielight, and we certainly hear from various groups, here's someone who started and is clearly doing better as part of an overall protocol. And all of us are interested in the same thing. What can we do for best outcomes? So we're really excited to have you here, Dr. Lim. Thanks so much for joining us.
Thank you very much. I was looking forward to this. In fact, Dr. Bredesen, I think we kind of got to know of each other, but we never got together. I think this is the first time we actually speak to each other live. Yeah, pleasure to be here.
Yes, long overdue.
Yeah. So if you like, I could, look at how we can relate directly to your 6 types of Alzheimer's. Would you like to do that? And
that would be great. So let's do that, because again, we're all interested, whether it's family members, friends, ourselves, whatever, how do we get best outcomes? And of course, for all of us, we'd like to be sharp and stay sharp until we're 100. So if you could, let's go ahead. I know you've got a couple of slides you could show. If you can show us a little bit about how this relates and how your exciting technology has been useful for people who have various things that are contributing to cognitive compromise, from inflammation to insulin resistance and so forth and so on. So yeah, please go ahead.
Well, let me start by saying some foundational facts.
Sure.
First of all, light in the red to near infrared spectrum, actually and beyond, penetrates a lot of substance. The longer penetrates more. But the issue is to get the right wavelength so you get the brain or the body to respond. So, FM radio waves are also, electromagnetic waves, but they don't draw the same kind of response. So with that understanding, we have devices that, you position in your nose, in your head, and it penetrates. Let me just show you an example so you have some context here.
Sure.
So this is an example of how, this is position. And there is this, the normal way of doing it is, through the nose to reach the brain.
Right.
I have some, for years, we've been lacking data on, for example, how the nose reaches the brain. Now we have actually incredible imaging to prove it. But I will share how it relates. I really love, your work, how it, how it comprehensively put together.
Right.
Oops, wrong one, sorry.
Yep. I get the right one up there, yeah.
Okay, here you go. Am I? Here.
There you go. It looks like
Okay,
something
great.
coming up here. Okay, good. So you're on type 4 vascular.
I want to actually go to, here you go. This is your,
There you go. Okay.
your 6 types of Alzheimer's. Now, believe it or not, photobiomodulation research has been going on for many years. I'm just one of the many who have been doing it.
Yeah.
Many universities and research institutions around the world have been doing it. And for each and every one of your type, inflammatory, atrophic, glycotoxic, toxic, vascular, traumatic, photobiomodulation can possibly help. Did I get all this right? Your 6 types?
That is correct. Yes.
Okay, great. Now, starting with inflammatory. So you and I understand that, a lot of it is attributable to inflammation. Even to, we're researching on long COVID now, even COVID.
Right.
The great news is a few days ago, Health Canada cleared us for our clinical trial on COVID-19,
Right.
demonstrating that with photobiomodulation, the way we do it, there is significantly quicker recovery, meeting the statistical significance. So that's cleared by Health Canada. FDA is still reviewing it. But this was on the Q19. Now we're going to go into long COVID. I can talk about it later, but let's get back to inflammation and try to relate it to COVID-2. Yeah. So here, there's evidence to show that photobiomodulation can reduce the cytokines. And this here, oh, I lost it, excuse me, okay. You can see that on the left here, yeah, that this came out of Stanford. It's just like literally last month, they showed that photobiomodulation can downregulate pro-inflammatory cytokines like IL-1, you probably recognize that, IL-18. Of
course, yeah.
And upregulate IL-10, which is the good guys. Yep. There are reviews being done, and it shows that this anti-inflammatory is found in quite a lot of different conditions, including neurodegenerative conditions. Absolutely. But, for many years, it's been based on animal studies. But while research on COVID-19 was coming out, we had, from my research, the first expression of improvements in a human study, but this relates to COVID-19, so which is great. But it shows that photobiomodulation can reduce the pro-inflammatory cytokines, in this case, IL-6, IL-10, IL-8. It reduced IL-10 to some measure, but the ratio between IL-10 and IL-6 showed that actually the increase in IL-10 was more. So that was on inflammation. And if you talk about autoimmune disease, and here I think you are also an expert in how it's affecting the expression of beta amyloid. And there's good work actually going on at the University of Toronto, headed by Professor Donald Weaver. Now his group has been on it for quite a while, and he's proposing that Alzheimer's disease is an autoimmune disease, really. You can not look into expression of beta amyloid in isolation. So when you have things like...
Sure. I mean, and beta amyloid, as you know, is really part of the innate immune system's response.
Right. So infection, trauma, ischemia, depression, pollution, all that can cause a release of beta amyloid. And okay, part of the beta amyloid, the amyloid protein is it's a neuroprotective mechanism in the brain. But because according to this group, according to Weaver, because the membrane of the neurons kind of has similar characteristics to the pathogens. You find that the amyloid, the beta amyloid is also attacking the neurons, and then you cause a cascade. So I'm saying, okay, let's see if we can reduce the expression of beta amyloid. I know there's controversy, there's a lot of discussion whether it's a valid, a symptom to go after.
Sure.
Now, photobiomodulation has shown in one of the studies on autoimmune multiple sclerosis that on animal that actually with photobiomodulation, it can actually help to reduce the scores and the symptoms of multiple sclerosis. Now, we don't see human because actually it's really difficult to do human trials. I know Jerry and Lauren, who's the chief investigator here. So if we can get to, I will cover amyloid on a gamma treatment later, but here, atrophic. Now you want to brain to heal and you want to have expressions of BDNF, brain-derived neurotrophic factors and other growth factors. So this is actually a fairly strong piece of an area of research within photobiomodulation. And this study, and the lower left, talked about the pathway ERK-CRB that leads to the expression of brain-derived neurotrophic factors. So
right.
That's one.
So you're still showing inflammatory here on the screen.
Oh, it hasn't moved. Are you seeing atrophic?
I'm seeing inflammatory. So let's get you down to the atrophic. If you can show that one.
I am showing atrophic on my screen.
Ah, okay. What I'm seeing is still inflammatory.
Oh. You
are share. Yeah, it says here you're viewing Dr. Lim's screen. Okay.
Okay. Okay. Let me without the screen share.
There you go. Now it's atrophic. Okay. You show the autoimmune disease. Okay.
Yeah. Then I will go on to. So I thought about atrophic. Dealing with atrophic, you want to express more of the trophic factors like BDNF. Which you speak about quite a lot.
BDNF is huge.
Yeah. So now this is a study that I was involved in on a traumatic brain injury case of a professional hockey player. There are problems. Clinically, he improved. But what we did, and imaging was done at UCSF by Professor Linda Chow. Mm-hmm. What we found with MRI was the regrowth of gray matters in the hippocampal area. Now, there are other works of photobiomodulation that shows, actually there seems to be in animal study, particularly regrowth in the hippocampal area. So we found this in a human being. It's only one case, but in my mind, it's very significant because for the first time, we're showing that brain cells can regrow with photobiomodulation.
Very exciting.
Yeah, and toxic. If you look at the research done in our field of photobiomodulation, there's quite a lot of review work, discussing about how you need to have your lymphatic system, how to drain away the unwanted deposits and debris away from your brain. So, the brain lymphatic system should be healthy to do that. There is some theory, hypothesis, and all that to show that photobiomodulation can work. And I would say they actually forgot to look at this particular study. Yeah, that was done with our device in Neuro Gamma by veterans in San Francisco through UCSF. So there was a couple of cases here in the case reports, but it shows that transcranial photobiomodulation improve toxins in the brain, as happened in Gulf War illness. So you go back to some history about the origin of Gulf War illness. It was the soldiers who fought in the Kuwait War in the late 90s came back with this problem, pain and lack of sleep, and the symptoms that you couldn't explain. So it could be attributable to these toxins they were breathing in the brain. But it seems that photobiomodulation is helping. At Boston, let me see. Here, okay. There was this here on the right. This the left one is done at UCSF. The right one is a bigger study done at Boston University.
Okay.
The Boston VA. So they did show improvement photobiomodulation on the brain with the gamma, which in theory helped to remove these toxins in the brain. So here is some evidence. Now, so 40 Hz gamma is discussed a lot in photobiomodulation. There was quite a lot of actually work done, particularly by another group at USF by Professor Muki, looking at brain the encoding of memory was correlated with the presence of gamma. And then it's some other studies and so on, looking at the mechanism. But MIT did this huge big study published in Nature. It was very significant in an animal study when they exposed these animals, the mice, to flickering lights at 40 Hertz. At that time, no one could explain why 40 Hertz work.
Yeah.
But it did. It reduced the level of beta amyloid, as I mentioned earlier, in the brain. So some ways it was clearing, and but we actually looked at this earlier because we were studying EEG expression in the brain too. But Professor Linda Cho of UCSF said, "Okay, I want to do this of gamma 40 Hertz," and this was a study that she published. Among other things, she actually studied 8 patients, 4 in control, 4, given the active Neuro Gamma pulsing at 40 Hertz with fMRI. She's also a professor of radiology, so she had access to the MRI scanners and so on. Now, fMRI, if you look at the after 12 weeks, you can see the brain has degenerated among the usual care patients. But in those who were exposed to photobiomodulation, actually, there were improved connectivity in certain nodes of the default mode network. Is seated in the PCC, which is part of it. But just looking at the images, you can see that the expressions were pretty pretty much stay the same or improve slightly.
Good to see. So Dr. Lim, let me just interrupt for one moment here. Just a couple of basics, because you're going through some beautiful data here, and I want to make sure that everybody can appreciate some of the things. So number one, you mentioned the wavelength of light. And often it's said that photobiomodulation is dependent upon cytochrome C and its absorption of light. What is the wavelength that you're typically using with Vielight, and how have you chosen that particular wavelength?
Okay. Well, thank you for asking, because I've prepared a bunch of slides so I can go back to some of those and show you. Now, here is a very well used, picture of what's happening in the mechanisms of photobiomodulation.
Okay.
If on the left here, you can see this one is actually a little bit old, but at the time when Michael Hamblin published this in 2016, just not that long ago. Now, there are two groups of, you can call, the spread of wavelengths between 900 and 1064, which is longer than what we use. We generally use 810. The light goes and activate here, light gated ion channel. Actually, it goes direct And on the picture on the right, you can see that, also here, the 900 to 1100 here this time, it actually goes direct and activate. What happens, it activates by water. It gets absorbed by water and activates calcium signaling and the heat and light gated ion channel to activate the brain. But with 810, which we use, it falls under this group that actually activate the mitochondria.
Yeah.
So when people talk about activating mitochondria, because for a long time now, there's discussion, okay, we want to activate cytochrome C oxidase, which is in the last terminal of the electron transport chain. Then you get this, you start activating transcription factors that help with BDNF and a bunch of other things. So here's where I want to clarify. Using 810 versus the 1070 is another discussion.
Right.
Neither one is right or not wrong. It depends on what you want to activate here. Both activate the brain. But if you want to activate the mitochondria, ATP and so on, 810 actually falls within that spread and activates that.
Okay.
So,
all right. And then could you talk a little bit about then you say if you want to activate mitochondria, use 810. Okay. Well, when do you use the 1070?
So here's where we still need to learn more, because both seem to activate the brain. So I've been having discussions with my research team. We actually see literature and some of the work we're doing. 1070 does activate the brain, but do we switch over 1070? Should we do more in 1070? But there's so much more clinical evidence that's coming out of 810 over the years. Is 1070 wrong? I said no, it's not wrong. Just that we haven't done enough research. So we're actually literally doing the research right now using imaging. But my team,
if someone were to buy Vielight today, number one, what's the wavelength? I assume that they would buy gamma. And how often would you recommend that they do it, and for how long?
So all our devices currently now for the brain uses 810 nanometers.
Okay.
And that is, so it doesn't mean that we'll stick to that forever, but at this moment in time, I would say that the body of clinical studies favor 810. And because 810, here is again, based on a collection of literature, somebody like Michael Hamblin has said, okay, it looks like between 600 to 900, 1100, or, sorry, to 850 would be activating the mitochondria. But it looks like, actually for a long time, people like him and me didn't think longer than that really works well. But the evidence showing that brain does respond to 1070. So we can't dismiss it. But I would say that 1070 activates the water structure, the light and heat gated ion channel to activate the brain. Whether it results in so much clinical level outcome, we don't know yet.
Yeah. Okay. Yeah. So, okay. But certainly we come across again and again and again, getting the appropriate activation of mitochondria is clearly an important thing for many neurodegenerative conditions. So this makes a lot of sense. And then, as you mentioned earlier, pulsing it. So you're talking about gamma, which is what's typically suggested for MCI, for dementia. So something like 40 hertz, 40 per second, 40 pulses per second. And do you recommend that people do this every day? Do you recommend that they do it a few times a week? What is your suggestion? And for how long should they be doing it? And should be once a day, twice a day? What do you recommend for best outcomes, at least? And I understand that you're still doing research, but for the best outcomes that you're aware of currently.
So here's my general recommendation. We have seen people with various conditions responding to, even to once a week twice a week, they seem to be doing well. And some sensitive people are saying, you know what, I can't even tolerate 20 minutes. These are outliers, by the way, they're not general population.
Yeah. When you say can't tolerate, because of headache, because of what?
Well, I would say these outliers are very sensitive. I almost label them as supernatural because they're so sensitive to the photons.
Yeah.
But they say, I just 10 minutes is enough for me, about once or twice a week. But on the other side of the spectrum are subjects with atrophy in the brain. So the brain is, are not so sensitive anymore, obviously, because the number of brain cells have been reduced. Yeah. Examples are, Alzheimer's disease and other neurodegenerative diseases. So they're not sensitive anymore. You could do, in fact, I wouldn't say just them. A lot of people can tolerate once a day, less than once, more than once a day, twice a day. They're not necessarily outliers. But I would say that those with say, Alzheimer's disease, as you progress, it gets less sensitive. They can tolerate more. So, so here, but in general, I would say in our clinical trials, this is what we propose. For those who have been tested to have MCI for Alzheimer's, they can do once a day. Give the 7-day rest, because the way it works is you don't want to overstimulate. So you want your brain to reset and be able to absorb more.
And the once a day for how long?
It's 20 minutes. It's set for 20 minutes. It's
20 minutes. Gotcha.
Yeah, it tells automatically with 20 minutes.
So once a day, 20 minutes, something like 5 or 6 times a week, but not 7 times a week. Is that fair to say?
Yeah. If you can tolerate 7 days a week. So I'm trying to generalize so that we don't have to make it so difficult to, to make a recommendation. Now, if for other people, if you're healthy, you want to improve your brain, if you have, say, you suffered a stroke, but you see significant improvement, I would say when you see improvement, cut back. Yeah. In photobiomodulation, there is such a thing as the biphasic response. If too little doesn't work, too much, you get overstimulated. Yes. You produce too much of free radicals and your brain will get rid of those things.
Yeah, good point. So what about for those of us who just like to be sharp? We're not complaining about memory loss, but we'd like to be a little sharper in our day-to-day interactions. What do you recommend for us?
Personally, myself, I do once every 2 days with a neuro, but I have other intranasals which are less, they have less power. Okay. That I do in between. But there's no hard and fast rule, but that works for me. I have done it every day, nothing wrong with my brain. So, but those who have experienced it, some have come back with quite remarkable feedback, like, they feel that their memory of improvement, even though they're healthy. I would say, I'm in my 60s now. I would say that my brain is as sharp as when I was in my 20s or 30s. How do I know? Because I've done IQ tests myself.
Yeah. And have you done tests on healthy volunteers and shown that you actually do see an improvement in cognition?
Yeah, we actually plan to do, we had an independent study done at the University of New Mexico by Vince Clark's group. He was actually funded by the US military and see if we could improve the mental performance of soldiers. And it was a small group. He found they actually improved in the stimulated response to threats, and the response. Okay. Decision making. So that small case, very hard to make a claim. But we want to do more of that. What we are doing right now is, on top of that, we want to see what happens to long-term meditators. The study is ongoing. I see some preliminary data. There's one study going on in University of Arizona in Tucson. There's another study that is ongoing in Toronto, which we're collaborating with the Center of Addiction and Mental Health, which is part of the University of Toronto. Yeah. Very, very interesting. It makes a difference. I won't have time to go into a lot of it today.
Sure. Well, look, we can discuss this again. I think we've got some fantastic questions here that have come across, and we've got dozens of them. So since we've got your expertise right here, and we're grateful for that, let's go through some of these excellent questions. And I recognize, the 6 types that you mentioned, you actually have data for all of these, which is fantastic. We greatly appreciate that. Again, we're all interested in the same thing, which is best outcomes for everybody. So there are a bunch of wonderful questions here. Here's one from Nancy, who says, I have PPA, primary progressive aphasia. This, as you know, is one of the non-amnestic presentations of Alzheimer's disease, and is something that we typically find is associated with toxin exposure, and interestingly responds to detox as well as responds to EWOT, exercise with oxygen therapy. And so she says, is the study of PPA with photobiomodulation of Vielight devices? If so, what does the study say? And have you looked at people who have primary progressive aphasia as a presentation of Alzheimer's disease?
There's somebody I work with, Dr. Margaret Naser of Boston University. She's somewhat of an expert in primary progressive aphasia, actually.
Great.
But not necessarily linked to Alzheimer's disease. But what she recommends is this. She used to be an expert in TMS, but she's also photobiomodulation now. But she said, just focus on treating the left side, because aphasia is really due to a dysfunctioning of the left side of the brain. So if you're using like the Neuro, I would shield the right side. So that's a recommendation, because like what she discovered for stroke, hemispheric stroke happens on one's left or right side.
Sure.
Always say, expose that part of the brain that has lesion. And she found that it's better than doing both sides. So
Interesting.
Both sides you get the brain talking to each other left and right, so that could be a problem.
And how is he shielding? What is he using to shield the other side?
You can use like aluminum foil to shield the modules.
Okay, good point. So this sounds like this could be something very helpful for Nancy, to be shielding the right side and doing more on the left side. And then she goes on to say, what's the frequency? I'm assuming that it would still be the gamma that you would recommend. Is that correct?
Yeah, actually, in this case, I'll recommend the alpha. There's which passes at 10 hertz. Yeah. Now, there's a lot of stuff that we are kind of discovering, 10 hertz, 40 hertz, all kind of hertz, actually. But I would say that the body of research for stimulating a healing, and that goes back to animal study done by Mike Hamblin in Harvard, going back quite a number of years. And he found that 10 hertz it works the best for traumatic brain injury, where there's lesions, in the brain. So let me differentiate this. So here we're talking about stimulating, say, BDNF growth factors in the brain.
Yes.
You see that 10 hertz is stimulatory. It seems to work better. And gamma, based on a number of research, including MIT, is suggesting that 40 hertz is activating processes in the brain, including activating a non-inflammatory microglia to help remove the debris in the brain, which is a little bit different in the mechanisms. So if you're stimulating the brain, like for stroke, we found this for traumatic brain injury as well. And we are recommending 10 hertz for, generally speaking, for traumatic brain injury, unless we're talking about CTE, which is another subject.
Okay, now this person obviously has PPA, which is not necessarily traumatic and probably not traumatic, but it is, as you indicated, it is lateralizing. She goes on to say, how often do you do this? Is it best in morning or afternoon and evening? And do you like to do it every day or 3 to 4? Now, you've said before, probably do it 5 or 6 days a week. What about time of day? Is there a preference there?
No, not really. You can do it any time of the day, but
Gotcha.
for clinical trial for Alzheimer's, we often say do it preferably when you're sleeping, you're going to sleep, or taking a nap, because that's when the lymphatic system in your brain gets more activated, and it helps to emphasize on the lymphatic drainage to remove like beta amyloid.
Okay, so you're recommending that people actually do this while they're sleeping, while they're napping, or you mean right before they go to sleep?
Okay, here is the gamma. You want to remove the unwanted deposits in the brain. So recognizing that that drainage system in your brain is most active when you're slumbering off or sleeping, then use the you use it when you're in this state. So that is for a neurodegenerative disease. But for alpha, in her case, it doesn't matter what time of the day.
I see. Okay. All right. There's one here from Sharon. Says, has your device been studied on glaucoma patients needing to get more blood/oxygen to the optic nerve part of the brain? So it's interesting. This brings up a whole, as you know, a whole field, red light for age-related changes in the eye. And there's some nice studies out of the UK showing improvement with age-related, not just glaucoma, but things like macular degeneration, especially with red light stimulation. Have you worked much with people with glaucoma?
We haven't actually. We haven't done much work on the eye, but I'll just say, like you mentioned, for dry age-related macular degeneration, and that goes is a different part of the eye, the macular area. Right. Red, they've been using 670 nanometers. The red seems to work. I think we got pretty good outcomes in clinical studies.
Okay.
Glaucoma, I don't have, I don't have much, or at least I don't recall.
Yeah.
Studies being done.
Gotcha. All right. And then Barbara is asking, I missed one here, Patricia. So Patricia's saying, would it be possible for the doctor to discuss the use of photobiomodulation in the treatment of early stage dry age-related macular degeneration? So this is basically just what you're talking about. And yes, I think this is going to be a field where you're going to see more and more. From our work, we would recommend you do more than just that, because you've got to think about oxygenation and mitochondrial function and how much blue light you're exposed to and what altitude you're living at, whether there are toxins around. There are a lot of other things in this systems biology approach, but clearly it does look as if some red light stimulation, and this again, a nice studies coming out of the UK to support that idea. And then Barbara asks, would infrared and near-infrared therapy helmet device help preventing cognitive decline or even stimulate mental acuity? Well, I think that's exactly what you're publishing. That's exactly what you're seeing. It looks like this is going to be, for many, many people, this is going to be very helpful and obviously should be part of the overall protocol for everybody to get that stimulation. Now, you mentioned alpha as well as gamma. You mentioned alpha as part of healing. It seems like most of us really want both. We want some degree of healing, but we also want some degree of mitochondrial activation. Do you ever recommend going back and forth and doing one for a period of time and then switching and then going back? Yeah,
we actually have the Neuro Duo, which comes with the alpha and gamma. So you can switch back and forth between 10 hertz and 40 hertz. Now, generally speaking, I would say that the 10 hertz actually works for a broader spectrum of conditions. And I would use gamma for cases where there is instances where you have to clear, deposits in the brain like tau or beta amyloid. So that happens in Alzheimer's disease, CTE in repetitive traumatic brain injury. In Parkinson's disease, where you have the deposits of alpha-synuclein deposits. So I say where there's neurodegeneration, you feel like your brain is kind of, you're not functioning as well. It could be, you need to get tested. So I would say generally the gamma. There's a lot of talk about gamma. Meditators love gamma because it's, gamma is when you get into a higher state or gamma and beyond. So we're finding that some really, really interesting stuff. Now, just a quick mention, trying to understand all these different frequencies. We're also doing basic cellular studies and see what happens if we pulse at different frequencies on living cells, on cancer cells. in real time to see how the cells are responding. And I say at the moment, the indication seems to be like this. The alpha seems to be stimulatory. As you reach 40 Hertz gamma, it seems to be switching over. And then as you go to higher frequencies, there's an inhibitory effect, you know. So it is still my kind of hypothesis and a bit speculative right now. We're still accumulating evidence, but it will give us indication of how we're going to be better, offer better products to people with different conditions. So they have different purposes. Frequency does matter, as I say. Yeah.
Okay, next one here is from Cliff. What's the difference between this and photodynamic therapy, PDT plus laser watch? Can you talk a little bit about the differences between Vielight and photodynamic therapy?
So photodynamic therapy is using, often is red or one of the different colors to activate an activating protein. And in quite a lot of research has been done in this area for cancer. So you inject this, this substance into your body, and when you shine light and say on the tumor, it activates these agents, and it creates a blast of reactive oxygen species, free radicals, that will theoretically attack the tumors. So that is photodynamic therapy. I haven't seen it done widely in other conditions. It's still kind of is unsettled. I think, the problem with clinical trials is very demanding. And when you introduce an agent into your body, it's, you got to be exercise extra care and so on. It's still ongoing. I think the interest has kind of simmered down a little bit.
Yeah.
Watch laser is, my guess is be similar as shining a laser diode onto your skin so it gets into your body.
Yeah.
It's different, yeah.
All right, then there's one here from Bella who says, any data on subcortical dementia / cognitive decline? Of course, this is essentially a generic term, subcortical dementia. There are a number of things that can give you a subcortical dementia. So I would recommend, please get evaluated, find out what different processes. The whole point here is that people have made these diagnoses as pathological diagnoses. Okay, it's Alzheimer's pathology, or it's Lewy body pathology, or it's Parkinson's associated dementia pathology, and so forth and so on. We're really now taking that next step to say, is this driven by a process that relates to a specific pathogen? What we call Alzheimer's disease is really a chronic, largely innate immune encephalitis that over time is causing a loss of network function. You're getting fewer and fewer synapses until the point that you have problems. And so the photobiomodulation is part of an overall approach to improve the function of the synapses, to improve the number of synapses. As Dr. Lim said, you're actually increasing BDNF, which is important. So I would find out what's causing the subcortical dementia, whether you work with a neurologist, whether you work with someone that we've trained now over 2,000 physicians, whatever. Next one here is from Alan saying, is it possible for photobiomodulation to be developed to stop the development of Alzheimer's completely with regular usage until a cure is discovered and available? Well, as we've talked about, this, of course, is about what's driving the process. And I think photobiomodulation has had wonderful effects, but it is not the only thing. If you have a specific infection that is driving this, you're going to want to get rid of that infection as well. But clearly the PBM has been very, very helpful. Dr. Lim, could you comment on people where they've had specific infections, or you mentioned the head trauma, or specific drivers of the problem? Have you seen people where the photobiomodulation is all that's needed, or do you recommend that they also look at what's actually driving the process?
Yeah, talking about head trauma, some of our most solid evidence is coming out of traumatic brain injury and what it does. we have an ongoing study at Boston University. It's been going on for a few years now. It's a randomized control study. So we're waiting for, for that to come out. But before that, just literally maybe about a couple of months ago, the lab in Boston University, led by Margaret Naser, actually published 4 cases of retired athletes. And the outcomes are really very significant. And these are athletes that are showing signs of CTE.
Right, very common.
Yeah, so what we're talking about, I can show you some of the slides here that I wanted to show you, because in your, let me find it. Yeah. So these are retired athletes. She had 4 cases.
Yeah.
And now look at I want to explain this, They went to her lab, the first week they were treated with photobiomodulation. It was not our device, it was a different device. It was from Medix Health. They actually had the LED, on the head.
Yeah.
This picture on the left, they actually had a stocking to hold it in place, right, for a week. Then, okay, clinical trial over, go back, you have shown improvements here. You're talking about executive function and like inhibition, false alarm rate, immediate recall, total recall and stuff. Then there is PTSD, depression, pain, the executive functioning. Now, what's happening is, okay, the 1 week they improve in the clinical outcomes. So these are, these are all responses. Like, I would maybe go to this one on top of PTSD. Okay, improved. But when the trial over, go away, and then they started reporting a reversal. So, so that suggests that and these are patients that have suspected CTE.
Right.
So it means that with a degenerative disease, you really have to just keep treating regularly. And then the lab suggested, okay, come back and we give you a device. This is actually the Neuro Gamma. Neuro Gamma, because degenerative, you want to get rid of the tau. And then they improved. So this trend is very, very clear. It shows that photobiomodulation works, and this is for CTE. So that's an example of TBI. Now, I want to talk about a very significant body of study that's coming out of University of Utah. They've done extensive work using the Vielight devices to treat generally athletes with a traumatic brain injury. Here's one that they presented as a poster, so I'm okay to show it to you. Now, symptoms like depression, PTSD, how the adjustment to life, sleeping, reaction time improves significantly. You will see more coming out. They did this more than a year ago. They're just taking time to write the manuscripts. You'll see the evidence being published, hopefully in a few months. So it was a PTSD. Now, while we were talking about this, I also want to say, because there's interest in Alzheimer's disease, I want to say that the Vielight devices generally are low-risk general wellness device under the category put out by FDA. So we don't make a medical claim. So I'm referring to all these into various evidence. But I'll say that we have submitted to FDA for this big clinical trial we're doing for severe Alzheimer's disease. We're submitting one for mild. We're going to submit one for long COVID. So I say that, I'm just referring to related evidence, but not claiming yet until we have the evidence.
I understand. I think it's worth pointing out, though, that you have people with depression, where depression seems to be responding to photobiomodulation quite nicely.
Yeah.
And I know something has been published on that just recently, as well as what you're showing here.
Right.
So I think this is very important, what you're showing here with CTE. I know we're running out of time here, so I want to take one more question here. There's one here from Michael, and then we can send you, if it's okay with you, let's send you the questions, because we've got about another 50 on here or so.
Okay.
Oh, actually, no, we're up to 80, so probably more like another 75. Lots and lots of questions, which is great. People have all sorts of questions about how to use this best. One of the points that Michael's asking about here is the coverage of the brain. He says, since you're looking at fueling mitochondria, it seems surrounding the brain would be more beneficial, but there must be some reason for the choice. So could you talk a little bit about why the stimulation, which is where the stimulation is, how did you choose that?
Okay, it's a very interesting question. And I would say that when we developed this, I worked with some collaborators, like Boston, Harvard, and said, okay, this is going back a few years, we want to hit the default mode network because it's like a template network of the brain. If it's healthy, it helps settle a lot of conditions. So we're looking at that. And you know what? About 2-3 years ago, we looked at the expression in EEG and see if we move this around, does it matter? So EEG shows that it matters because it seems to activate different parts of the network. And then where we did on meditators as well, we had this and we moved it somewhere else. They didn't experience the same thing. Now for that, it's quite complicated, I would say. At that high frequency was activating the salience network. Now we have a reason to do that, but I want to, this is my chance to show our, what we found. Having said that, now this is novel. We are collaborating with Baycrest Hospital, which is part of the University of Toronto. They are presenting this in a brain imaging conference this month in Montreal. So I'm okay to share this with you. Now, this is actually positioning on the right, a laser, real-time imaging in fMRI. So not many people can do this, but we've designed the device in such a way. So this on the right prefrontal, on the right, you can see real activation, left not so much. So it's actually quite global. And when we introduce a left intranasal combined with the right, the whole brain gets lit up. It shows that the nasal itself works, on the head it works, but I don't want to go into the details, but the power matters. You need quite significant. We need actually, did I say here, 150 milliwatts. So it's not small numbers if we can do it. And you have this kind of expression in cerebral blood flow. Dr. Bredesen, you're into cerebral blood flow. This is the demonstration of cerebral blood flow in significant ways, much more significant than what I've seen in the literature for magnetic stimulation or electrical stimulation.
Right.
So
that's exciting. So that offers a wonderful way to stimulate blood flow. And you've already shown improvement in mitochondrial function. You've talked about healing. You've talked about trophic factors. So it does appear that there are multiple mechanisms, and we appreciate your showing us these data. Very exciting, and we should probably have a follow-up to continue to talk about this. I think we're all looking at how do we translate this today into best outcomes for people who are either at risk for cognitive decline or who are suffering some cognitive decline. So this looks very, very promising, and again, lots of people already using it very successfully. We're running out of time here. Have any final words you want to say before we wrap up here?
Well, first of all, thank you. I want to thank everybody for the interest. I know we've not had a chance to kind of speak to everybody. We are a very research-oriented company, as you can tell. We are crazily, disproportionately interested in the research because I think we're only discovering a small percentage. We're just opening the gate. We have like at least 91% of more information to be, or more discovery to be made. And I didn't do this alone. We have a team of highly qualified researchers. We have sometimes I think 7 PhDs and MDs in a small company. We have at least 30 or more collaborators around the world. And we are still going to new things like, we're using maybe fancy to a lot of people, like magnetic resonance spectroscopy to understand what are the metabolites that are happening. But watch us, as we progress, we will tell people what we just share with people, new information. Hopefully, we make the world a better place.
Absolutely. Yeah. So more and more exciting things to come. We look forward to that. And we appreciate the fact that you've already developed things that are highly clinically useful. So Dr. Lim, thank you so much for your many years of work, of research, for your commitment, and for your continued development. And we look forward to talking to you again.
Thank you. I want to thank
Thanks, everybody. We'll see you next time.